Hello. This video is to demonstrate the proper technique for insertion of central lines under ultrasound guidance. We'll be using the Sonosite Micromax ultrasound machine, which is the machine that is present in the ICU. We'll also go through the proper techniques for caring for the machine, setting it up properly, and also the proper documentation that is required every time a central line or other type of ultrasound is used. The Sonosite Micromax ultrasound is a compact portable ultrasound unit which is capable of doing a wide variety of ultrasound techniques. It is capable of doing vascular and Doppler type ultrasounds and is quite portable and has a battery which allows it to be used at the bedside. When the Sonosite is used for central line insertion, it must be plugged into the wall. This is in order for the printing device and the DVD recorder, if installed, to record any images that are desired. Use of ultrasound to insert central lines has been shown to decrease the incidence of complications and therefore is highly recommended. The suggested location for ICU patients and central lines is the subclavian position. The ultrasound can be quite helpful in determining the location of the central line within the subclavian vein. The power cord is located on the back of the ultrasound machine. The machine should be plugged in whenever it is in use, and it should also be plugged in when it is stored to keep the battery fully charged. The ultrasound machine to be turned on is turned on here with the power button. The machine, when turning on, will go through a self-test procedure. For central line insertion, the proper probe is the linear probe. The probe is attached to the bottom of the ultrasound machine here. Each of these probes is worth over $10,000, and they can be easily damaged by dropping them or by running over the cords with the ultrasound machine. At all times during insertion of central line, you must have control of the transducer and ensure it does not fall on the floor. And also, when moving the machine or securing it, ensure that the transducer cords are properly locked up and will not come to grief with the wheels of the machine or by being pulled out of the machine. The ultrasound log is on the machine and should be referred to every time an ultrasound is done. Within the logbook, you will find the procedures for performing the ultrasound. Each step is explained, including how the central line insertion is done with ultrasound, and also the issues for such issues as billing and quality assurance. Every time an ultrasound is done, it must be documented in the patient's chart. Is indicated. Indications for performing the scan and any important findings are indicated. This form is kept within the log and is used later for ultrasound quality assurance rounds. This is important to be done every time an ultrasound is done so that your ultrasound skills are properly quality assessed. To use the ultrasound machine, after the machine is plugged in, make sure that it is turned on. Connect the transducer at the bottom of the machine for the appropriate probe. For central line insertion, you'll be using the linear probe. Make sure that the machine is in the proper mode. It should show the vascular linear probe has been inserted. This indicates vascular linear and a 3.8 megahertz probe. Make sure the machine is in the general mode. The mode is set down here. It should not be in MB or any other mode. The green dot indicates the index position on the probe. This is helpful for orientating yourself in terms of the machine. The green dot indicates that this is this side of the probe. Make sure that the correct date and time are shown on the machine. The patient's name should be entered by pressing the patient button. Enter the patient's name and MRN. When done, hit the patient button again, or the done button. You'll now notice the patient's name and MRN are on the image and will be preserved if the image is printed or recorded to the DVD recorder. Depth shedding should be shallow. The subclavian vein is rarely deeper than 3 to 4 centimeters, and therefore you should only have 3 to 4 centimeters of depth showing on the machine. Depth is set with the depth buttons here. The depth of the total image is indicated on the bottom. Typically 3.8, 4.7, or 5.9 is sufficiently deep for central line insertion.